Hello everyone, welcome back to Gentle Guide RN. Today we are going to talk about something super important, but also something that doesn't come in your skill checklist or get graded in your placement evaluations, and that is emotional intelligence. It is not just about staying calm or being nice. It's about understanding your own emotions, managing them, and being able to see things from other person's point of view. And even when you feel like flipping a table. Emotional intelligence means being aware of what you feel, understanding why you feel that way, and choosing how to respond instead of just reacting. Alright, let's jump into a real life scenario. Your fresh morning shift. You went into your patient's room full of energy, enthusiastic, ready to save the day. You say, "Good morning, Mrs. Porter. My name is Dimi. I'm gonna be your nurse today. I'm here to help you freshen up and getting ready for the day." And they completely ignore you. Like you are a ghost. Nothing. Not even a blink. So you try again, gently. And then comes the comment. "You don't know what you're doing. Don't touch me. You're doing it wrong. How old are you? Are you a nurse? Really? Go and study something before you come and touch me. Okay? Go." And boom. There goes your morning. It's not even 7:25 and you are already on the edge. This is where emotional intelligence steps in. First of all, acknowledge what you're feeling. You are trying your best, and this is not going the way you hoped or wanted. You are annoyed, and that feeling is valid. Take a deep breath, pause, and ask yourself, why is this patient feeling this way? Have you listened to that tone? It's curious. It's not judgmental. It's not asking a question. It's being curious on what's going on. Is she in pain? Is she scared? Does she have any trauma around care? Or is she simply having a bad morning? Now you don't guess. You ask. Try saying, "Hey, you don't look okay this morning. Is there anything that I can help to make you feel a bit more comfortable?" If they continue to be rude or abusive, say, "I'm here to help, but I would appreciate if we could talk to each other respectfully." You are not there to be mistreated. If things escalate, get help. Let your team leader know. You are a student nurse, not a superhero. Support is a part of safe practice. Sometimes it's as simple as giving them a warm blanket or a cup of tea. Other times, there might be deeper behavioral issues. Do not assume. Be curious. No judgments. Okay, let's look at another common situation. You are assigned to work with your preceptor RN for the day. You are excited, ready to learn. But she barely says hi. She looks irritated. When you try to help, she say, too many hands, can't work like this." Wait, what? You are there to learn. You're being respectful. You're trying to assist. But now you're feeling confused, rejected, a bit anxious, and if we are really honest, a bit hurt. First, pause. Acknowledge what you're feeling. Confusion, disappointment, maybe even anger. That's okay. Those feelings are real. But instead of acting on them or going silent, take a step back. Ask, why might she be acting this way? Curious. Is she overwhelmed? Under pressure? Did something happen before the starting of this shift? Now you have two healthy options. First, If you are comfortable, talk to her gently. Hi, just checking. Is it okay for me to work with you today? I don't want to be on the way. She might open up. She might say no. But that's information that you can work with. If you don't feel comfortable doing that, go to your facilitator. Talk to them calmly. Explain the situation. I'm finding it difficult to work with this RN. I don't feel like it's beneficial for my learning. Can I be placed with someone else, please? This is not drama. This is communication. You are not blaming. You are just being honest. Emotional intelligence is not about hiding your emotions. It's about knowing them, being honest with yourself, and making decisions based on understanding, not based on reaction. Here is some key tips. Acknowledge your feelings. Ask questions before assuming. Communicate clearly and kindly. Ask for support when you need it. Stay curious, not judgmental. Next time you're feeling overwhelmed or confused on your placement, ask yourself, what am I really feeling? What could be going on with the other person? What is the best way to respond? So, whether it's a tricky patient, stressed preceptor, or just a messy day, remember, emotional intelligence doesn't solve every problem, but it helps you handle every problem better. You are learning, you are growing, you do not have to get it all perfect. You just have to keep trying. Thank you for watching. If it helped you, don't forget to give it a thumbs up and subscribe for more gentle and practical guidance. And tell me in the comments, have you had a bad moment where emotional intelligence saved your day? I'd love to hear. I'm Nimi, this is Gentle Guide RN, and I will see you on the next video.